It's my pleasure to introduce today's special presentation, Truth in Medicine and the Need to Engage the Diverse Patient Voice, led by Dr. Richard Barron, President and CEO of the American Board of Internal Medicine and the ABIM Foundation. Dr. Barron is a staunch patient advocate who has committed much of his professional career to elevating the medical profession and maintaining standards of professional excellence. The ABIM was founded in 1936 to establish more uniform standards for physicians and professional certification. ABIM is considered the highest standard, the platinum standard, in internal medicine. ABIM provides certifications for medical subspecialties, including nephrology. The next time you go to the doctor, check out their office wall and look for their ABIM certification, if they are certified. That is a mark of excellence. As kidney patients, it's not uncommon for us to manage multiple comorbidities. To do this, we choose to partner with doctors we select, and we try to choose physicians who respect us as patients, understand our lives and aspirations, and who are experts in the field of medicine. That last point is critically important. Expertise in kidney medicine and other conditions we experience can determine our life or death. This is why AAKP and ABIM share a common goal, namely that any doctor involved with a kidney patient must be a credentialed expert. ABIM has been a leader in putting patients first and involving patients in deliberations regarding the substance of professional certifications in kidney medicine. In fact, ABIM has selected 2 AAKP board leaders to serve on the ABIM Nephrology Specialty Board. Paul Conway, our Chair of Policy and Global Affairs, and Dr. Janice Lee. Dr. Barron and his colleagues were instrumental in reaching out to the kidney community and making these selections. It's an honor to have Dr. Barron share with us how the ABIM is elevating the importance of objective truth in medical information, the vital role this organization plays in certification and recertification of American physicians and nephrologists, and how accountability in these certifications play a role in modern medicine as the basis for trust between patients and the doctors they choose. Dr. Barron holds great influence in the direction of the ABIM, and we thank him for joining us today. Dr. Barron, I turn things over to you.
Thanks, Ed, for that lovely introduction, and even more, thank you to Paul Conway and to Dr. Janice Lee, who are responsible for my being able to speak with you at the American Association of Kidney Patients 47th Annual National Meeting on Patient Consumers Leaders for Kidney Research and Innovation. And that's a wonderful title and a wonderful theme, because in my role at the American Board of Internal Medicine, we, as I'm sure all of you know, are the ones who provide certification to nephrologists and other internal medicine subspecialists. And we are speaking to the expertise that they have, the training they have to provide excellent care for you. And we think it's a really important credential because over time, knowledge changes. And the credential is not just something people get at the beginning of career, where we provide initial certification, which says that they're ready for independent practice, but it's a credential that evolves over the course of career because knowledge changes over the course of a career, and our credential continuously monitors whether people are staying current in the field. And in a field with as many changes as nephrology has, that's pretty important. We're living at a very strange time in American medicine right now. The whole question of whether there is such a thing as a medical fact is being called into question. And I think there's a lot of reasons for this. I think, sadly, we've done a lot in the profession to lose trust from patients, to lose trust from many people in society. And I think many institutions in the country have lost trust. And in an environment where patients, people, you, don't trust institutions to care for you, don't trust government or hospitals or health systems to have your best interests at heart, it can feel like you're kind of on your own and you need to figure out how to take care of yourself. And of course, you do need to take care of yourself. Of course, you do need to collaborate. Of course, you do need to work closely with the team that is providing care for you. But I think what we're all living in a society where expertise is, we all rely on it. We all rely on it. I'm speaking to you from a 17th floor office. I took an elevator to get to this office. I have no idea how elevators work. I couldn't repair an elevator. I couldn't design an elevator. I couldn't build an elevator. But I need to rely on an elevator to get to my office. And many of you, particularly those, for example, with end-stage kidney disease, may be relying on dialysis teams. Some of you may be doing home dialysis. Some of you may be awaiting transplants. Some of you may have already received transplants. All of those things require extraordinary amounts of expertise, knowledge, technology that is the product of long study, hard work, and the product of great research, of trained people asking questions about the right way to do things and trying to generate answers. In an environment where we start to lose trust, we find ourselves skeptical, dubious that those people have our interests at heart, and maybe we don't pay as much attention to them. Maybe we think we need to do our own research. And I have a core model. I was in community practice for 30 years in the community in which I live in Philadelphia. I practiced general internal medicine and geriatrics. And the way I always thought of it was, I have learned a lot. I have read many journal articles. I have gone to medical school. I have gone to many professional meetings. That makes me kind of an expert in a lot of things medical. But every patient who came to my office, every patient I worked with, was an expert in themselves. Whatever I knew about medicine, about science, about the latest research, I knew that, but I didn't begin to know the lives that my patients had. And I tried, and I wanted to, and I thought it was a major part of the work that I got to do with my patients, getting to know them, getting to understand their priorities. But I thought my core job was to connect my knowledge, my expertise, with the predicament that the patient had. And every patient has a predicament. That's why they're there in the doctor. Something is going on. It's why they've come in. It's what they're hoping for. And each of you have predicaments. Sometimes they're medical, sometimes they're social. A variety of factors come together to create the predicament. But I think the goal of scientific medicine is to put at your service the knowledge, expertise that the clinician actually has. At our best, we succeed in doing that. It isn't going to be news to you that we're not at our best every day. There are lots of times that I'm sure each of you have had interactions with doctors that were disappointing or frustrating. She's not listening to me. She doesn't understand who I am. She's giving me some kind of crazy advice that's disconnected from my world. She's asking me to do something that makes no sense or that I couldn't possibly do. And those are times when we're not succeeding as much as we wish we were as doctors. We're not connecting to the predicament that the patient has. But I earnestly hope, and the American Board of Internal Medicine and the Foundation are trying to do a lot of work in this area to restore trustworthiness in the profession, to encourage colleagues to behave in more trustworthy ways. And that's everything from learning how to pronounce your name, to remembering important aspects of your life and connecting your goals with the kinds of treatment options that we might be able to generate in healthcare. But what's happening now, going back to the comment about we don't even reliably agree that there's such a thing as a medical fact, whether a vaccine works or doesn't work, whether a dialysis machine works or doesn't work, whether a transplant is successful or not, that can't depend on your political affiliation. It can't depend on your political beliefs. It can't be that if you're in one party, one set of things is true, And if you're in another party, some other set of things is true. And yet, we're seeing that more and more, that people with different political affiliations, political anxieties may be more distrustful. And there's good reasons to be distrustful. As we look at healthcare disparities in this country, as we see the disparate outcomes that have occurred for Black people and white people in COVID, particularly at the beginning of the pandemic, it's hard, if you're African American, not to conclude that the system is not there to serve you. The system has structural racism in it that can generate a lack of trust, that can cause you to believe that what's being recommended to you may not really be in your interest. And yet, we need to find a way past that, because the vaccine does not work in a political way. A dialysis machine does not work in a political way. It's based on a methodology for determining what is true. And it took us a while in medicine to get there, to learn that, to learn about reliable ways to generate new knowledge. And now we're living in a world where social media is a way that many people are learning the things that they're learning. And they are believing that it must be true if a lot of people say it. Well, we're not going to have a vote on what kinds of things are effective transplant medications. We don't want that. None of us want a world where what we're doing is crowdsourcing the truth. We want a world where the scientific medicine generates knowledge that can be of service to patients. That's really where we want to be. And patients need to be deep collaborators, both in the generation of what knowledge they want to know, and also, most importantly and most personally, in the application of that knowledge to the individual patient and the individual predicament that they have. We're seeing a world where many patients are saying, I want particular drugs for COVID-19, either to prevent it or to treat it, when we have study after study showing those drugs don't work. Drugs like hydroxychloroquine, drugs like ivermectin, they really don't work. There have been multiple studies in the New England Journal of Medicine and other journals that show the drugs don't work. And yet, we have people demanding them and saying the only reason you're not willing to prescribe them is because you're part of some broad cabal that is captured by pharma, or you're part of a Bill Gates conspiracy or something. And it just isn't true. It just isn't right. How do we get through a world where we have lack of trust, we have expertise, we have patients with predicaments, and we want to put the expert knowledge of doctors in service to the patients that we take care of? And I earnestly hope that we don't lose faith in the idea that there are medical facts. There are lots of things we don't know. There are lots of situations where we may not know the right answer, but some things really are wrong. And I recently learned about a Supreme Court case in the United States from 1902 called the American Society of Magnetic Healing versus McAnulty. And the American Society of Magnetic Healing was an organization doing business out of Nevada, Missouri, and they were receiving 3,000 pieces of mail a day. And what was in that mail were checks and money orders purchasing medical services from the American Society of Medical Healing. And what they were buying was, the society was advertising in newspapers throughout the country, and they were advertising magnetic healing services. So the way it worked was you sent them $10 and they sent you a letter. And the letter said, on Tuesday morning, September 24th, wherever you are, lie down, and we here in Nevada, Missouri, will channel the healing energy of the universe to you, and we will make you better. We will heal you. And then one day they didn't get any mail because the post office had decided they were operating a fraudulent operation. They were committing mail fraud. They were collecting money from patients for some imaginary service that did not work. In 1902, and the school, when the post office stopped delivering mail, filed a lawsuit. They went to court. They said, we're a legitimate business in Missouri. Why won't the post office deliver mail to us? It went to the United States Supreme Court. And the court, believe it or not, found in favor of the American School of Magnetic Healing. And the court's reasoning was, we don't really know how the mind and the body interact. We don't really know how magnetism works. Maybe this does work. Maybe this actually works. So you can't say it's a fraud because there's no way to know the truth of anything in medicine. Well, that's 120 years ago. I think we've made a lot of progress. I think there are lots of ways to know the truth in medicine. And I hope you will be able to work with your doctors to find that truth, figure out how that truth applies to you, how that truth can make you better. And I applaud the American Association of Kidney Patients for focusing on this issue at this year's meeting because it is so timely at the time of misinformation. And I hope you all will help all of us become more trustworthy and work with us to help meet your needs and be sure that we use our expertise and our science to address your predicament. Thanks again, Paul and Janice, for inviting me, and thanks for your service to the American Board of Internal Medicine. We are stronger to have patient voices at every level of our governance, and thank you for being there. I really appreciate the opportunity.
Thank you, Dr. Barron. That was an excellent presentation. In an age of misinformation and speculation, thank you for being an advocate for objective truth in medicine. You have outlined the important role ABIM plays in setting the standards for physicians across the many disciplines and how that impacts the lives of patients who invest their trust and health to these medical professionals. On behalf of AAKP, we look forward to continued partnership with the ABIM and its nephrology specialty board.